Hello, Illumination, and welcome to this month's fun shop that we have here in the office on avoiding tech neck and other postural issues. And it's so important, guys, because our posture is a window into what the spine looks like. And you see here, it's proposing the question, well, what is posture? And posture, it's maintaining the spine in alignment. And in doing so, that's going to put the least strain on muscles, tendons, and ligaments during movement and weight-bearing activities. Because so often, when our spine and posture shift out of healthy alignment, that causes muscular imbalances, which causes tightness and tension in muscles and ligaments and tendons, but also puts additional stress on our joints, causing inflammation and pain. But most importantly, it begins to put stress on the nerves and it affects function of our body. So posture is so important because again, it involves aligning the body in a way that's going to minimize strain on your muscles and on your joints. And we have to remember that muscles are designed to move the body. Muscles are not designed to stabilize the spine. But oftentimes that is what happens because the spine and posture shift out of alignment in a negative way. So posture is important because not only does it help to reduce back and neck pain, it helps to improve your quality of breathing. When you have a maintain an upright posture and position, it's going to help you to breathe much more sufficiently and easier. It's going to support your joint health because it's not putting stress on those joints. And when we have a good, healthy posture, it's going to help boost our confidence and our overall mood on a daily basis. It enhances your digestion as well as circulation throughout the body. It improves your focus and your productivity in your day-to-day activities or work that you need to do. And most importantly, it enhances nervous system function. And we know that if your nervous system is functioning at a high level, you are going to feel and function much better, which leads to a better quality of health and life. So, how is your posture assessed? And that is exactly what we do here in the office. My niche and specialty is in postural assessment, but also in correction. And there's various ways that we can do that. We can do that through x-rays, as you see here. We can do that through postural pictures and assessments that you see on the top right, where that green vertical line is where this patient's posture should be aligned with. And we see those dots at the shoulder blade to the ear, have those how those have translated forward. In that side picture, she's lost the curve in the neck. And you'll see in the picture that she is looking directly at us, you see how the shoulders are unlevel. And you see how there's a lateral translation in her neck and spine off to the patient's left side, to our right. And we can measure and we can use these as tools to measure and track a patient's progress. And we also use these neurological studies, which helps us to measure tightness and tension in and along the spine in the muscles that are on the left and the right hand side. And you see, this is an example of a healthy nerve study on the left, where you see the bars are white and it's symmetric. And you look at the study on the right and you see how there's asymmetries and you see how there's different colors from red to black to green to white to blue, which tells us where there's extra tension or stress on the muscles because of the way that the posture has changed. So, how does your posture decline? Well, it declines through cumulative stresses that we do on a day-to-day basis, repetitive habits and poor ergonomics, muscular imbalances like what we just saw in that EMG study, aging and structural changes, neurological and psychological factors play a huge role, and compensation patterns where our body and spine and posture begin to adapt to the positions that we take on a regular basis. And you see this individual that is hunched over her laptop there, that is a often posture and position that most of us take on, including myself, if we're not mindful. So what is tech neck? So tech neck refers to the neck and the upper back pain, stiffness, and postural issues that are caused by prolonged use of devices like smartphones, tablets, and laptops. And you see this diagram that we have here with the individual on the far left. That is where the head should rest in a healthy spine and a healthy posture. And you'll notice that when that head begins to translate forward, and we start to see from 15 degrees to 30 degrees to 45 degrees to 60 degrees, you'll see that as that head translates forward, it puts additional stress and strain on the muscles, the joints, and ligaments of our body, which can begin to affect function and movement and overall health. So, what causes tech neck? Well, the main cause is obviously poor posture, especially when we bend the head forward for long periods of time to look at our screens, look at our tablets, look at our phones. We have slouching of the shoulders. And again, when we are in these positions for long durations, that will put stress and strain on muscles, tendons, ligaments, and the spine and the joints. So the primary cause of tech neck is poor posture while we use these devices. So mindfulness goes a long way. And extended periods of looking down at screens combined with a lack of ergonomic support exacerbate the condition. They make it worse. Other risk factors include age, lack of physical activity, and existing musculoskeletal issues that are only going to worsen the impact of that prolonged digital device use. So understanding tech neck. So the average adult head, it weighs anywhere between 10 to 12 pounds. However, when it's tilted forward, when it translates out of healthy alignment, even at an angle of 15 degrees, the effective weight increases to about 27 pounds. And at 45 degrees, you're almost getting 50 pounds. And at 60 degrees, it's almost 60 pounds. So again, for every inch that that head shifts forward, it puts additional strain throughout the rest of your spine and your nerve system and joints of the body. So we have some statistics here. So on average, people spend anywhere between 3 to 5 hours a day on their phone, with some even using it for well over 8 hours. So smartphones, they dominate usage 4 hours a day on average, totaling around 1,400 hours a year. So among smartphone users, 46% of those experienced some type of neck disorder in the past year, and 62.6% exhibiting tech neck posture and 55.3% showing signs of phone addiction. And it's easily something that we can get addicted to because it's those dopamine hits that we get by looking at the screen, and it is very addictive. And we see that in children in earlier and earlier ages, unfortunately. And we also know that higher screen time, when we use the smartphone for more than 6 hours a day, that does correlate with a 2 to 6 percent higher risk of neck pain. And sedentary behavior of 6 hours or more of sitting, it increases neck pain and almost by 88%, friends. So with phone use alone, raising it by 82% versus 23% for computers. So who is most affected by tech neck? Well, it's our young adults and teenagers. Office workers and remote workers that are constantly hunched over the phone or the computer or tablet throughout the day. Heavy mobile device users, gamers, all of these individuals are affected. So why are children going to be more susceptible to tech neck? And when we look at this posture here, look at this child. And 30% of the patients that I see in the office are children. And unfortunately, the children that are coming in are like this posture here because of the fact that their spines and their bodies and muscles and ligaments, they are developing. And when we are in postures like this, it's going to easily have an impact in a negative way on the spine and the posture and our overall nervous system. And there's so many kids that have a huge amount of screen time because that's the world that we're in. There's tablets and computers at school, tablets and computers at home that they spend a lot of time on, and there's poor ergonomics. And unfortunately, there's a lack of awareness on that. And because of the lack of awareness on that, they're on those much more, and there's not any physical activity. You rarely see kids playing outside anymore. They want to be in front of a phone or a tablet or a screen or computer. We have signs and symptoms of tech neck. And some physical symptoms are obviously going to be pain and stiffness. We have upper back discomfort. We often feel it in our shoulders. And headaches is a big one. In last month's workshop that we had was around headaches, and we know that there's different types, and a lot of those can be related directly to the spine and to the posture. Obviously, we know that forward head posture is something that can take an effect, and that can begin to reduce our range of motion. Some other neurological symptoms is numbness or tingling in the upper extremities, but not just in the upper extremities. We can also get numbness and tingling down and through the lower extremities because of a neck problem. There can also be weakness in the upper extremities, and we often see that in our grip strength or in our forearm strength because of neurological problems and changes because of our spine and posture being out of alignment. And it also begins to affect our behavior, and we see visual signs. And this is something that we see frequently in children whenever there's these postural changes. Frequent tilting or craning of the neck, slouching posture, and it begins to affect their productivity and attention span throughout the day, and also their mood. So, what can tech neck lead to? Well, we know that it can contribute to some musculoskeletal issues like what we see here, chronic neck pain, even herniated or bulging discs because of the stress that takes place, and it begins to cause those discs to actually tear, which will then contribute to a bulge or herniation. Cervical spondylosis, that is degenerative changes in the disc or in the joint itself. And when we have postural changes, that speeds up the rate of osteoarthritic and spondylosis in the spine. We have upper cross syndrome, where the head translates forward as well as the shoulders roll forward and begins to affect the shoulder and rotator cuff. As you see here, shoulder impingement and rotator cuff issues. And some other potential issues, it begins to affect and cause TMJ or jaw dysfunction. It affects our lung capacity and it affects our breathing. It can affect and cause poor sleep quality. And we have early onset of postural kyphosis, where it's a rounding of the shoulders and an increase in the inflammation in through that cervical thoracic transition area, causing what we call a Dowager's hump, where inflammation accumulates and builds up. And again, we know that it begins to affect our cognitive function, especially in children. Some neurological symptoms is we begin to get paresthesias, it's nerve compression or radiculopathies, radiating pain that stems from maybe the lower back down into the extremities, or maybe it's the neck into, the shoulders or, the arms or the hands. And we know that it can contribute to headaches, not just tension headaches, but also migraine headaches. And it can also begin to affect and cause dizziness and balance issues like vertigo. So there's a lot of ways that we can prevent and have ways that we can recover maintaining a good, healthy spine and posture. There's office ergonomics. We want to make sure that we're using an adjustable chair. And when you do use an adjustable chair, make sure that your feet are flat on the ground. Your knees need to be at 90 degrees. And the lumbar spine needs to be well supported so that way you're not slouching. Keep the monitor or phone at eye level or even slightly above eye level so you have your head in extension. And you're maintaining a comfortable distance from the device. You want to maintain a neutral spine where your ears are going to be aligned with the shoulders and your shoulders are going to be over the hips. If you use a laptop stand. Have an external keyboard and a mouse so that way you can make sure that you maintain, everything at 90 degrees. Sit stand desks are great to achieve a preferred sitting standing ratio of 1 to 1. And you want to make sure that you're taking frequent breaks throughout the day. And we tell you to take the 20-20-20 rule, where every 20 minutes you look at something 20 feet away for 20 seconds. And again, you want to make sure that you're not only doing the 20-20-20 rule, but you're setting reminders to stand up, stretch, and walk every hour and maybe even every 20 minutes. Sleep ergonomics is key. And that's why we encourage a neck nest pillow here in the office because maintaining a healthy sleep posture and position is going to be so crucial and beneficial to not only help your adjustments to hold, but to maintain a healthy spine and posture throughout the night. So you want to make sure that your mattress, it's a medium to firm mattress. You want to have a pillow that supports the neck curve, which is why we encourage the neck nest pillow. If you don't have a neck nest pillow, we encourage you to ask about that on your next visit in the office and we can get you one. You want to make sure that you keep the head, neck, and spine in a neutral position, which that pillow does so. And if you do sleep on your side or you sleep on your back, use a small pillow under the knees and in between the knees for side sleeping. And you want to make sure that you're practicing your spinal hygiene before bed, or you have some type of rhythm that you can do that on a frequent and daily basis. Because just like our dental hygiene, we have to brush and floss our teeth on a daily basis, we should also maintain our spinal hygiene on a regular and daily basis as well. Ergonomic solutions and some tips for children who use a backpack. Make sure that you're using both straps. There's two straps on a backpack. We have to make sure that we use both of them. Don't just wear it on one side. And also, when we do wear it, we want to wear it correctly, where the bottom of the backpack should sit on top of the buttocks, and the straps should be adjusted accordingly for the backpack to do so. When you pack the backpack, make sure that the heavier items are going to be closer toward the spine. And you're going to want to make sure that it's not dragging down and pulling and causing a rounding of the shoulders. So these good daily backpack habits will help with your kids' spinal health and safety throughout the day. A digital detox. Oftentimes we need to unplug, get away from the technology, the computers, the phones, the tablets, because that is going to be so beneficial when we're not getting screen time and we are actually moving our body and spine as it's designed and meant to move on a daily basis. Exercises and stretching techniques. Regular exercises and stretching techniques can greatly reduce the amount of tension from your neck and your spine. And when you incorporate these practices into a daily routine, it not only helps to alleviate current discomfort, but it's also going to aid in preventing future issues that are going to develop and occur. Movement, guys, is our greatest medicine. And chiropractic, incorporating regular chiropractic adjustments and care, as well as assessing your spine and nerve system into a regular routine, is going to help you to address any of these issues or imbalances that can contribute to poor posture, but not just poor posture, but a core quality of health. So the key is regular. Just like we should get regular movement, we need to make sure that we're regularly getting our spine and nerve system checked. So when we can manage and prevent tech neck, and we know that it takes a village of things that are going to help us to maintain a healthy spine and posture. But when we do so, it involves a multifaceted approach that includes ergonomic adjustments, regular exercises, and conscious efforts to maintain good posture. So when we understand the condition and implement these strategies that we just talked about, we can all enhance our well-being in today's technology-driven environment. Thank you guys, and I hope that you use the information that we shared with you today to not just maintain your healthy posture, but to have a good quality of healthy life.